In our 21 Days of Wellness Chats, we are here today with Dr. Namrata Anand to talk about pregnancy health. Pregnancy marks a beautiful yet an ambivalent time in a woman's life. On one hand, there's excitement and joy, but on the other, pregnancy can be marked with health issues, sleep disorders, and depression. This is during and also postpartum. So, Namrata, as an expert, I'd like to ask you, what are some of the do's and don'ts of a healthy pregnancy?
Hi, Anshu. Thank you for having me. And you're right. Pregnancy is such a stressful time on a female body, regardless, especially with COVID. It doesn't get any easier. So, the three don'ts that I want to touch on first is don't do it alone. I think in during COVID times, it's important to create that cohort for yourself, create that little support system, only people that you are seeing and people that are only seeing you, because you shouldn't feel like you're isolated in this time. Hormones are all over the place. Everything is, your body's going through so many changes that feeling like we're isolated is not going to help any pregnant woman. So find a cohort. That's and don't do it alone. That's don't number one. Don't number two, I would say, is a well known don't. Don't smoke or drink, particularly because our brains have nicotinic receptors. So, smoking is a very highly addictive thing for our brains, and it can also cross the blood brain barrier and the placental barrier. So, it's very bad for the fetus. And in times like this, when we're trying to build up our immunity, build up our respiratory drive, make sure that we're at the healthiest we can be, smoking and drinking right now is not the best idea. And then don't number three is stay away from hot tubs and saunas. Ideally, this should be easier right now because they're all closed, anyways. But if you do live in a place that has a hot tub, dry sauna, wet sauna, or swimming pool, I would stay away. Partly because the warm temperatures of the hot tubs and saunas are not good for the fetus because it can increase their fetal heart rate because it increases your maternal heart rate. And the second reason they say this may not be a good idea is because babies cannot thermoregulate themselves quite yet. They learn how to do that in the third trimester. So they may not be able to feel overheated. And ideally, these are not scientifically proven, but they say if you can stay away from hot tub and saunas, do stay away from hot tubs and saunas. That's just the better, more healthier way to proceed during this pregnancy. And for the fun things, the things that you should do,
Mhm.
um, first of all, is take your vitamins. Do number one. All pregnant women, if you're listening, please take your vitamins. Ideally, you should start prenatal vitamins before you conceive because folic acid, which is the major vitamin, is very important in the neurodevelopment of the baby. So you should start taking your vitamins early. If you're trying to get pregnant, your iron, your vitamin B12, your folic acid, and your vitamin D. The reason I asked add vitamin D is because we're in Canada and we're going into our winter months. The sun is setting around 4:30. Doesn't add to the mental health and it doesn't add to the amount of sun that we get either. So stock up on your vitamin D as well. The second would be to work out. So in pregnancy, it is said 3 to 5 times a week, 30 minutes of low intensity exercise is very healthy and very good for pregnant women. Nothing high intensity, but low intensity, 30 minutes, 3 to 5 times a week. The reason that's even more important now is because during COVID, the big battle is to make sure that our mental health is regulated. And especially for pregnant women, to make sure that they don't feel isolated, they don't feel like everything in their body's changing, they don't feel that like they don't start getting antenatal or prenatal or postpartum depression. So working out is key for that. Keep moving. Yoga is really good for the pelvic floor. Walking is really good. Light jogging, anything that's low intensity is great. So I urge all the pregnant women out there to keep working out. And lastly, the third do is to eat proportionately. I know a lot of times for pregnant women, they hear you are eating for two. Essentially, that is correct, but you are not doubling your calories. So when I say eating for two, I mean a good rule of thumb is to increase your diet by 100 to 150 calories daily intake for the first trimester, 200 to 250 in the second trimester, 300 to 350 in the third trimester. That way, you're eating proportionally and you're getting the right nutrients for you and your baby, but you're not doubling your calories because you want to gain weight in a timely manner. You want to eat proportionately. It'll be the healthiest for the pregnancy, and it'll also be the healthiest to keep blood pressure and glucose levels down.
Mm.
So, just to quickly recap, those are my three do's and don'ts. Don't do it alone. Don't smoke or drink. And don't go into hot tubs and saunas. Do work out, do eat proportionately, and do take your vitamins.
Yes, that was, yeah, that was great information. As a matter of fact, I think they are little things.
Yeah.
They're so important for the do's and don'ts. And I was like, oh my God, I wish I knew this when I was having my babies. But thank you all the same for sharing that. Also, you talked a little bit about mental health.
Mm-hmm.
And I know that right now during this holiday season, all of our mental health, I think, it is a bit disrupted due to all the restrictions that we have. We have to stay in the house and do all of the things. So, what are some of your suggestions for pregnant women and their well-being in this holiday season? During this holiday season,
I
what would
think I think even though we can't have a community and we can't go out a lot, but there is a lot of stuff that hasn't been taken away from us. Like you can go for a walk, you can you can still enjoy nature, you can still enjoy fresh air. And for mental health, I think it's less about what you do; it's with the intention and the mindset that you do it. So I think for if you're someone that's staying indoors because you're really worried about your pregnancy, try meditation, try an adult coloring book, try just walking around the house, try cleaning, try anything that you think gives you peace. That'll be the best for your mental health. If you need to be outside, do that, take that exercise that you need to do anyways, take it outside. Don't do a low intensity workout inside. Go for a 30-minute walk. That covers nature, it covers kind of separating work and life. It covers the exercise you need to do. Go for a walk or sit on a bench and do some breathing exercises. I think in this time, especially this entire year, but especially for pregnant women, I think really advocating for your mental health and really understanding what your body needs is crucial. And each person handles anxiety very differently. We all have our triggers and we all have things that calm us down. Finding what calms you down and just finding a way to do it, I think would be the best advice I could give.
That was said so well, Namrata. I think we all are our own individuals, and finding what sort of gives us that, what calms us down. I think it's very important, and it's this is not sort of a one size fits all exercise. So that was really great advice.
And I would even add to have that community aspect. If you don't have a cord, if it's just you and your partner, make sure that you guys go for walks together because not only does that give you your exercise for your duration of your pregnancy, but it also gives bonding time for you guys as partners and for also your partner with your baby. I think going on these walks together, doing meditation together, doing yoga together, at the end of the day, if you feel bonded in your pregnancy, then it's going to be a easier process.
Thank you so much, Namrata. Thank you once again for joining us and sharing such great insights and wisdom with us. I really appreciate your time. Thank you to all our viewers for tuning in and watching. Please stay tuned for more amazing episodes coming on this 21 Day of Wellness Chats. And please do subscribe to our channel. Thank you so much.
Thank you.